welcome to this very special naming ceremony honoring our distinguished guests, Dan and Martina Lewis. In fact, Dan, just so everyone knows who you are, can you please stand? I'm trying to find you. Okay, right in front of me. Please stand. And this ceremony actually will officially mark the establishment of, and you see on the monitors around the room, the Daniel and Martina Lewis Healthcare Center for Innovation and Technology. My name is Christopher Capuano, and I am the University Provost and Senior Vice President for Academic Affairs at Fairleigh Dickinson University. My job today is not only to thank Dan and Martina for their incredible generosity. Excuse me a minute.
Did you take your medication today?
No, I did not take my medication. But I did take my blood pressure. So Dean Electroni, this is his newest toy. He's going to tell us a little bit about it in a few minutes. So, have you named this device yet?
We're open for suggestions.
Okay, so we're taking suggestions on, and this is the latest technology in patient care. When a physician can actually communicate with a patient without being there. And not only provide instructions, see the patient, take blood pressure, do glucose monitoring, you name it. So there are a number of new apps that are being developed for this device, but it's really incredible. It's a robotic patient care monitoring system that removes the physician from the immediate location, which is terrific. So let me begin again before I was interrupted. My job today is not only to thank Dan and Martina for their incredible generosity, and they have been remarkably generous to the university, but also to provide you with a sense of how amazing Dan and Martina really are. Not only have they made a $1 million commitment to this new center, which, by the way, will be used entirely to support graduate student scholarships in the health sciences. They have previously given the university $1 million for the Daniel and Martina Lewis Endowed Scholarship Fund, the J. Michael Adams Global Scholarship Fund, and a host of other important FDU initiatives over the past several years. Dan, as some of you know, is a member of the Fairleigh Dickinson University Board of Trustees, a recipient of the university's Pinnacle Award, which goes to the university's most successful alumni, and a Charter Day honoree. He is also on the board of the Salk Institute of Biological Studies, where he was recently elected vice chairman, and the Dean's Council at Purdue University's College of Technology. Dan has an undergraduate degree in aviation technology and industrial management from Purdue University, so he and I are fellow Boilermakers, and also an MBA from Fairleigh Dickinson University. So he is one of FDU's sons and clearly one of its most distinguished alumni. In 1978, Dan joined the international consulting group Booz Allen. Within 6 years, he was appointed vice president, then managing partner, and then a member of the board of directors, and then president of Booz Allen's worldwide commercial business. When Dan left Booz Allen a few years ago, he had an important decision to make. Should he serve on corporate boards, as many of his peers had done, or should he take another path, lending his time and many talents to the nonprofit world, which is in fact what he chose to do, serving, as I mentioned earlier, on boards at Fairleigh Dickinson University, Purdue University, and the Salk Institute. So, you see, that's the kind of person Dan is, and that's the kind of woman Dan married. Both Dan and Martina are concerned about the world they live in, and they are involved as active participants in making the world a better place. Dan and Martina's commitment to improving healthcare and healthcare delivery is just one example. Dan has several loves. The first, of course, is Martina and his children. The second is a boat called the Sporty Game. It's a 64-foot Bertram sport fishing boat docked in the marina at Cabo San Lucas in Mexico, from which Dan likes to fish for marlin. Rick and I had that experience not too long ago, and it was successful for me, but not so for Rick. I'll tell you about that later.
That's right.
More importantly, last October, Dan and his crew entered and won the Brisbee's Black and Blue Tournament when they pulled in a 337-pound blue marlin. The prize, as you could imagine, was substantial. So what did Dan do with that prize? Well, first he paid his crew, and he paid his taxes, and then he made a very large donation to the Salk Institute, and another very large donation to FDU. And he did this because Dan and Martina, more than anything else, have very generous hearts. Dan gives his intellect, his passion, and his resources to those organizations that he graciously serves. And all of us are better off because of that. Clearly, FDU is better off because of Dan and Martina. And the Daniel and Martina Lewis Center for Healthcare, Innovation, and Technology, housed here in our School of Pharmacy, is a fitting tribute to two individuals who understand what it means to make a difference in the lives of others. Thank you, Dan, and thank you, Martina. The university has a new and very exciting and ambitious, I might add, strategic plan, which Dan helped to craft from the very beginning. And a major component of that plan is the university's commitment to strengthen and expand its programming in the health sciences. The Daniel and Martina Lewis Center for Healthcare, Innovation, and Technology is the first step toward achieving that goal. Dan, Martina, I promise you, we won't let you down. It is now my pleasure to introduce Dr. Michael Electroni, Dean of FDU School of Pharmacy, who will tell us more about the Lewis Center. Mike?
Thank you very much and good afternoon. My name is Michael Electroni. I am the Dean of the School of Pharmacy, and I am delighted to be able to talk to you today and extremely grateful on behalf of all of the faculty and staff to Dan and Martina Lewis for their generous donation and the wonderful partnership that lies ahead. We are excited, as you can see, because the future of healthcare right now is, for many cases, a blank slate. And we are here as a university and as a school and as a program really to put our footprint and our name on it. I think most people who you would talk to would tell you about how healthcare as it was practiced 10 years ago, 5 years ago, 3 years ago, even a year ago, has changed, and it's not going back. Through the Affordable Care Act and through the shortage of physicians and through the change in the payment structure for services rendered in healthcare, we know that the new model of healthcare will be around outcomes and focus on improving health outcomes, and will be changed forever by those who we educate and by those who innovate alongside of us. And so we're extremely excited to be able to take on the challenges that lie ahead and to have this center really be the catalyst and the impetus for a lot of the change that will bring forward a new healthcare paradigm that we're all excited to roll out. And I just want to give a little bit of an oversight of some of the things that we're looking at doing and some of the things that we've already done as part of this center and some of the partnerships that we've already begun to roll out as an opportunity for us to be able to provide new and exciting opportunities for our students and for those who we serve in the community and in the nation and beyond. The first of these, as you saw a little bit of a demonstration of, is our Virtual Care and Wellness Initiative. This is one of a little bit of a snapshot of many things that we're looking to do with many partners who have already jumped on board. One of these is Atlantic Health, as an example. We are working at rolling out, integrating new methods of technology to be able to deliver care virtually. Some of the opportunities that are unfolding before our very eyes that are simply new devices that are paradigm changers are things like wearable technologies, things like the Apple Watch, the Fitbit, and other sorts of things, technology like what you see here, which provides access to people that simply have not had access before. Oftentimes you think about people who have rural settings, people who are in the furthest reaches of the earth who don't have access to primary care. Devices like what you're seeing here will provide greater and greater access to the ends of the earth to be able to deliver health care. We're seeing models whereby devices like this attached to and integrated with blood pressure cuffs like the one that you can, I believe I had under here, which is actually looks just like this, which plugs into an iPad. Other devices like blood glucose monitors, other devices like scales and other wearables will allow us to get a real-time snapshot of patients, specifically focusing on patients who are at high risk. What you may know is that most of the expense that healthcare sees is typically around a very small portion of population suffering from chronic diseases. And so the goal is to be able to integrate technology to help those living with chronic diseases manage those diseases and effectively improve their life expectancy and their outcomes overall. So those who are living with conditions like diabetes, chronic heart failure, COPD and asthma, and many others will have the opportunity to have this integrated care that provides access 24 hours a day, 7 days a week, and always has them within a reach of a physician, a pharmacist, a nurse, or another healthcare professional. Additionally, we've already begun a partnership with Barnabas Health, taking on our opportunity to roll out an expanded role for higher education inside the medical home and the accountable care organization. We actually currently have hired our first faculty member as a shared venture with Barnabas Health, who will be working alongside the accountable care organization, treating and essentially monitoring patients who are at high risk for readmission and rehospitalization. The Affordable Care Act now rolled out language that warrants those who are considered to be readmitted within 30 days for the same disease state as not being reimbursable for the services rendered inside the hospital. What it essentially means is that there are large-scale penalties for what are oftentimes referred to as frequent flyers, people who are not properly managing their disease state. And so our goal is to utilize the pharmacist and other healthcare professionals to integrate and better assimilate care comprehensively across the continuum of services with the purposes of improving the health outcomes of the people who are being treated and to reduce or minimize the costs of readmission. And so we're currently working right now with a pharmacist who is serving as the liaison, calling those who are at high risk using typically a scale of measurement for chronic diseases within the area of diabetes and for chronic heart failure, and focusing primarily on monitoring those folks to make sure that they're compliant with their medication, that they are not experiencing any side effects, that they're filling properly their refills and their regimen of prescriptions, and that they don't have any additional needs that could not be easily met by a visiting nurse or by another healthcare professional who could be deployed. As many of you have seen, and those who have not will have the opportunity to do so in a little while, a third arm of this center is our sterile compounding training facility. What you, I'm sure, have heard about have been some sentinel events over the past few years that have resulted in loss of life and major catastrophic episodes as a result of contamination of injectables that are given to patients who have typically come down with things like viral meningitis or other sorts of catastrophic diseases as a result of improper protocols in the area of sterile compounding. And so in this specific area, we are focusing on educating not just our own students, but the community at large on the best practices involving U.S. Pharmacopoeia's Chapter 797 guidelines, which are the guidelines for compliance for following protocols for injectables and other types of biological devices for the purpose of integration into the body. The goal here is to educate tomorrow's professionals on best and proper protocols, but to also allow those who are currently practicing in the state and in the region to learn alongside our partners and others who are teaching in and learning in this facility, which is a state-of-the-art facility. We were grateful for a gift from Becton Dickinson, which allowed us to begin the build-out of this. We've had subsequent gifts from Baker Grifols, who have outfitted some of the equipment inside, and we continue to build partnerships to allow us to utilize this space and to really be able to innovate and advance this towards the advent of a new chapter that USP is rolling out, Chapter 800, which will continue to advance the overall protocols and to continue to advance the overall adherence factors for sterile compounding and proper protocols therein. And then the fourth of these areas that we're looking to innovate within is one that we're looking to innovate and roll out in the next year or so, and that is our Global Alliance for Pharmacists. And we're excited about this one because it speaks in line with the global mission of the university and the global role that we have and are obligated to deliver as healthcare providers that we're educating here within the school. As I'm sure you know, pharmacists have taken on new roles in a host of different areas that didn't exist simply a decade ago. Pharmacists went from being typically dispensers of medication to now the #1 immunizers within the United States. Additionally, they are able to monitor and stay up on a number of disease states that a generation ago were epidemic in proportion and were catastrophic when contracted. Things like HIV/AIDS, which were typically a death sentence 20 years ago, are now managed effectively by drug regimens that are oftentimes monitored very closely by pharmacists and other healthcare professionals who are treating these folks and allowing them high quality of life for decades at a time. Our hope is to be able to roll out the advances that have happened in the United States over this last decade in the area of pharmacy and bring this globally, utilizing the partnerships of the university and the opportunities that we have to continue to build partnerships with the purposes of allowing our students and our faculty and all the members of our team to be able to go out and be agents of change in a global community. We're very excited about having the opportunity to work with partnerships in the UN and the WHO with the hopes that we can become immunizers that can go and be recognized internationally for the role that we can play in being able to really have a maintenance condition played to or rolled out in the areas of things like malaria, in HIV/AIDS, in other disease states that are typically managed very effectively here, but are managed much less effectively in underprivileged or underserved countries. And so we're very excited about all of these things, and we're very excited about the future of how they integrate together. As Chris alluded to, the next steps of our strategic plan will continue to evolve and roll out additional health science offerings at this university, and it's our goal to utilize the Daniel and Martina Lewis Center for Healthcare Innovation and Technology to be a catalyst and center point to bring all of these healthcare educators and students together to learn from one another and to be able to change the world as they go out from here. And so we're extremely excited about our future and the future of this center, the future of healthcare education at this university, and the opportunities that we'll have to continue to work together to build a better community globally, locally, and at this university. And so on behalf of all of the faculty, staff, and students at Fairleigh Dickinson University School of Pharmacy, it is my great pleasure to thank you both for your generous gift and to present, as a token of our appreciation, an engraved FDU School of Pharmacy mortar and pestle. Feel free to make the university's best guacamole if you'd like, or just display it proudly. But again, we just want to thank you on behalf of all of our students who will be the recipients of your generous gift, on behalf of our faculty and staff, and certainly on behalf of me as well. And now, without further ado, it's my pleasure to introduce our university president, Sheldon Drucker, who will share some comments as well.
Michael, when are you ever going to get passionate about what you do? Good afternoon. It's my great honor as part of this ceremony today to honor Dan and Martina Lewis for their generosity to Fairleigh Dickinson University and to dedicate the Lewis Center for Healthcare Innovation and Technology. It's really a wonderful day, despite the rain and a little cold out there, but we really thank you both for your support and your generosity. Fairleigh Dickinson has more than 120,000 alumni. They come from dozens of countries around the globe and from every state in the union. They work in public life and in the private sector, from captains of industry to authors, inventors, teachers, and scientists. They're an impressive group of people who bring distinction to the university. Among the most impressive, as you heard, is Dan Lewis. As an active and involved member of the Board of Trustees, I think it's fair to say that I got to know Dan pretty well over the last 4 years. This is what I can tell you about Dan Lewis. He is focused. He is determined. He's committed to the values and mission of this great university. When I think of Dan, I'm reminded of a quote by Henry David Thoreau, who said, "One is not born into the world to do everything, but to do something." And that's what Dan has done. He's done something very important. He and Martina has helped to shape this university, to make it a better place for learning, and to ensure that the FDU is a leader in education for our students, and that our students have the financial means through scholarships to attend this university. And I want to emphasize one other thing. Dan and Martina's donation is not only really great, it's just absolutely amazing. Thank you so much. But it is Dan and his other attributes that I most value as a graduate of FDU and a trustee and a friend. Dean Electroni shared with some of the things we are planning to do with this new center. I'd like to share with you the center's mission statement. The Daniel and Martina Lewis Center for Healthcare Innovation and Technology is an academic center focused on fostering collaboration between subject matter experts from within and outside the university to work together in a collaborative environment that promotes the advancement of healthcare delivery and improves patient and population health outcomes. Within the center, interdisciplinary and interprofessional knowledge transfer and collaboration allows esteemed subject matter experts to educate and train current and future healthcare leaders while exploring research and scholarship opportunities, focusing on ways to change paradigms of healthcare delivery at the local, national, and global levels. As you can see by looking around at this facility, you see so many things that we do specially, in a special way. And because of Dan and Martina, we can. Let me share with you one more quote with you before I invite Dan up here to say a few words. Nelson Mandela said, "What counts in life is not the fact that we have lived. It is what difference we have made to the lives of others that will determine the significance of the life we lead." Dan and Martina are two people whose lives have been and will continue to be significant. Dan, would you like to come up here and say a few words?
Well, thank you, Shelley, Chris, Michael. Yes, wonderful passion. I just want to say that, and I guess in our world, I don't think we've done something very special. I think actually we spoke up too loud in a couple of trustees' meetings and got inside. And Stu Kranzman, myself, and one other trustee who's no longer with us, but we got the chance to get ourselves involved in helping frame a strategic plan. And as we did, we learned a great deal about the university, a great deal of how much really hard work has been done here before we even arrived. And so I'd like to say that, sometimes you shouldn't speak up, but in this particular case, we did. And the beneficiary of that was us. We learned something that we thought could really be a relevant part of what our whole strategy has been, which is to really do some things with a treasure that, frankly, I never grew up with. So that's what we did. And I've been involved in the Salk Institute for more than 10 years, Purdue University for quite a long time as well. And this has been a wonderful experience. It's demonstrated to me how a lot of hard work has been done to save the university over a long period of time and to help it prosper. And in fact, see it prosper on so many different fronts with a mission statement that's largely unchanged since its founding. That's a very special thing. And when I see the students and I see them coming through now, and I think about my own experiences, I think this is a very, very special place. So this is pretty easy, in my view, to have come to this conclusion. Plus, I believe very much in the future here. I think the future is bright. And higher education is challenged on a number of fronts, and Fairleigh Dickinson is among those that are equally challenged. But I do believe with hard work and continuing to work on things that are crucially important, providing growth avenues for the university, that it will prosper for many, many years beyond that. So I'd like to thank you on behalf of Martina and myself for giving us an opportunity to be here. Okay. Thank you.
Let's get as many hands up.
Right at this,
Chris, right here.